Hello everyone, this is Dr. Shishma Sarila, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about how the bulky uterus impacts pregnancy. So let me explain it to you on better terms with a diagram so that you can understand it in easier manner. So here we are taking, this is the uterus, right? And this is the fallopian tube. As you can see, these are the fallopian tubes and this is the ovary that is surrounding it. Okay, so fertilization takes place here. Okay, or the conception period happens here. So if you are having bulky uterus alone, then this conception or fertilization might not be a problem. But if you have complication with fibroid and it is blocking this fallopian tube, then the sperm will not come and meet the ovary which is in the fallopian tube. So what will happen? Fertilization only will not take place. So that is the problem. Second thing, okay, there are no fibroids, baby, the fertilization has taken place and the baby has come from here till here. It has come and implanted here. Okay. So for this travel to happen, you should not have any fibroids here. So if it is complicated with fibroids, it is always a little bit problematic to deal that case. Once it has come and started here and implanted itself here, what will happen? That is, what are the complications you will, you will have. So remember that the fetus is demanding. Okay, it is attached and it should grow, but you have fibroids anywhere, the growth will be restricted and you can have or experience miscarriages. It depends upon the location, the size of the fibroid, right? But during fetal development, even if you are having a bulky uterus, if it is in a milder form, then that is okay. But if the bulky uterus is very severe, the symptoms are severe, or if the bulky uterus is really thicker and you're feeling lower abdominal swelling, you have to understand that the bulky uterus itself demands blood supply. So the blood supply to fetus is decreased. So fetus development will go down. First thing. Second thing, because it is bulky uterus and it is already expanded to a certain amount or certain size and shape, as you progress through your pregnancy, the expansion of the uterus is too much and it can lead into what is called as preterm labor. That is, you can experience labor in the 7th month, in the 8th month also. And some people even earlier if they have really thick or bulky uterus, not getting blood supply. And apart from this preterm complication, you might experience another one which is called as fetal restriction. Why? Because bulky uterus is thick, it's not expanding properly, the fetus is not able to move properly, it is constricted, hence it can cause fetal restriction. And if it is complicated with fibroids or endometriosis or adenomyosis or PCOS, the number of complications increasing, the number of, it is that difficult to get pregnant first of all, and then after pregnancy also it is problematic to carry the baby properly, right? This is how bulky uterus will impact pregnancy. So should everybody be worried about this bulky uterus, or should every person who is suffering with bulky uterus? Then no, it is important that you take certain considerations. First one is individual variability. It depends upon your family history, on your lifestyle, on your hormonal level, on the complications that you have, like if it is super added with something or not. Even if two persons who are suffering from bulky uterus in the same family, both of them might not be experiencing same symptoms. Even if the symptoms are same, the hormonal level might not be the same, or the body reaction might not be the same. So it is important that you consult a doctor and not someone who has the same disease. To don't go for advice to a person who is already suffering from this disease, because their experience might differ from your experience. Second thing is the underlying cause. It's always important to know what is the underlying cause of this bulky uterus. Is it the hormonal fluctuation? Is it the fibroid? Is it endometriosis? Or is it endometrial hyperplasia? What is the underlying cause, and what are you doing to decrease the cause or decrease the trigger so that this bulky uterus will come back to the normal size? Okay, so understanding cause is important, knowing that you're an individual is important, and apart from that, early diagnosis and management is important. If you're someone who's going to get married, get this simple test done. First and foremost simple test done that you have to do is get a CBP, which is complete blood picture. Second one, get compulsory USG scan to know if there is any underlying cause, and might be you might not have had symptoms of it, or even if you're having symptoms, you did not track your period properly, so you do not even know what the symptoms are. And the third thing, apart from USG scan and CBP, try to get a lipid profile done, because hyperlipidemia can sometimes cause or be a background cause for hormonal imbalances. And then what is the fourth test? Get a hormone profile done. In hormone profile, include every hormone, LH, FSH, prolactin, and then estrogen, progesterone, and even testosterone, and even AMH, which is anti-Mullerian hormone. So by having an assessment of the hormones, having an assessment of the internal parts of the body, that is the uterus and the reproductive system, and then having an assessment of the quality of blood, if everything ticks okay, you're good to go. If there is some problem, having an early diagnosis, it will help in good prognosis, and it will not complicate the case. So it will be easy for you, and you will be able to come back much stronger if the diagnosis is much earlier. Now coming to the consultation options, at Fidicus Homeopathy we have two kinds of consultation options. One is online consultation option, and the other one is offline consultation option. If you're someone who's staying the nearest branch of Fidicus, you can come and contact us in person. And if you're someone who's staying far away from us, you can contact us online through audio consultation or through the video consultation option. Once the consultation is done, once you have had your investigations verified, especially to online clients, medicines will be door delivered to you. If you're staying in India, 3 to 4 business days. If you're staying in USA, 3 to 5 business days. Anywhere across the globe, we can take 4 to 8 business days for our medicines to reach your doorstep. If you want to get in touch with us or contact us, you can call us, WhatsApp us, or messages on this number, which is displayed on the screen. And if you'd like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. Here we have discussed how homeopathy has a better choice in treating these lifestyle disorders or these female reproductive organ diseases. Here we'll be discussing how Fidicus Homeopathy is the best choice in homeopathy. Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. The first one being highest success rate. Here we are already experiencing high success rate in treating endometriosis, adenomyosis, bulky uterus, fibroids, dysmenorrhea, ovarian cysts like hemorrhagic cyst or chocolate cyst, or even cervical erosion as for that matter. So apart from having high success rate in all of these female reproductive diseases, we have transparent treatment. What is transparent treatment? There is no gray area between the patient and the doctor. Here the prognosis will be clearly explained to you. And apart from that, the personal care here at Fidicus Homeopathy is top notch. Any sort of queries, myths that you have, questions that you have, everything will be answered. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.